Hello, my name is Jill Haddon, and I chose Lyme disease to research. And here goes my presentation. So, what is Lyme disease? Lyme disease comes from an organism that is called Borrelia burgdorferi, and I'm sure I'm not pronouncing that correctly. Anyhow, it is a gram-negative spiral sheet, which just means it has a spiral body and flagella within two membranes. And this organism is a bacterium. So how can this organism be cultured and isolated? Borrelia has been found nearly impossible to culture. And that's just because of the type of body that it has. It being a spiral sheet, it's constantly moving. And normally just a single blood sample rarely captures this organism because it can move quickly from the bloodstream. The best way to culture this organism is by obtaining a skin biopsy from the edge of the most common sign of this disease, which is the bullseye rash. So by getting the skin biopsy from the edge of this bullseye rash is the best way to culture this organism. It does require a very complicated culture medium and long incubation times, approximately 12 to 48 hours. In a lab, it uses a medium BSK, which includes rabbit serum, which is interesting. It can be isolated most frequently from the skin, blood, and cerebral spinal fluid. So how is it acquired? Well, Lyme disease, it can be found in animals, insects, humans, pretty much any kind of mammal. It is transmitted by a black-legged tick, which can also be known as deer ticks. So ticks is basically the corporate of it. Where is this disease found? Mostly in the northern hemisphere in the world. Most prevalent countries are North America, being us, United States, and Europe. There's different life stages to a tick. You've got an adult female, adult male, a nymph, and a larva, which is basically when they start out like as eggs, then the larva, then they become the adult. The mechanism by which the organisms cause disease, like I said, it uses a tick vector. Basically, the tick has eggs, and is infected with this, and then this infected tick then bites the human, which is going to cause the disease. The greatest risk for this disease is during the spring and summer months. Also, it's always important to know how to properly remove a tick. If you do happen to find a tick on you, always pull the tick straight up. Don't try to twist or jerk the tick around because this could actually break off pieces of the tick's mouth, leaving part of the tick embedded in the skin. Be sure to clean the area with alcohol after removing the tick. Wash your hands afterwards. You want to dispose of the live tick by flushing it down the toilet, placing it in alcohol, or wrapping it tightly with tape. What are the signs and symptoms of this disease? Fever, chills, fatigue, headache, body ache, swollen lymph nodes, and skin rash called erythema migrans. Most common first sign is the bullseye rash. And there's all different forms of this erythema migrans and what they actually look like. So diagnosis of the Lyme disease. So you can do serological testing with blood samples, EIA or immune fluorescence assay as the first test, and then these tests are used to detect antibodies that are present, which in response to the infection. So it's a two method way that is used, followed by a Western immunoblot assay, and the detection can take months to develop, which can cause a false negative. What's the treatment of Lyme disease? So treatment is usually oral antibiotics such as doxycycline or amoxicillin. It's normally given twice a day for 10 to 14 days. Some cases do require longer antibiotic therapy, just depending on the severity of the illness. Sometimes some people develop what is called post-treatment Lyme disease syndrome. And this is just when patients experience prolonged fatigue, pain in the joints, and have difficulty thinking. And it can last more than 6 months after treatment was complete. The cause of why some people develop this PTLDS is unknown at this time. And there's no current treatment for this condition. Some ways to prevent Lyme disease. Always wear repellent, tick repellent, preferably that contains DEET, and wear protective clothing such as long sleeves, enclosed shoes, long pants, especially when you're outdoors in the woods, that sort of thing. And then, when you come inside, make sure you shower soon after being outside. Make sure that you check for ticks, check your children and your pets for ticks as well. And that's all. Thanks.